Addiction is a brain disorder. It is a disease, and I know a lot of people challenge that. If someone could stop that easily, they would. Nobody wants to be controlled 24/7 by a drug that they're spending so much time and money chasing and obsessed with to make them feel normal.
For me to describe withdrawal, it is basically having flu symptoms times 100. You get the headaches, and then you have the chills, and then, you bowel problems, and, you're vomiting.
Seeing a person go through opiate withdrawal is a pretty horrific experience, and it isn't something you would wish on anyone. Medicated assisted treatment is using a medication to help those who suffer with opioid use disorder. It helps with their cravings and withdrawal symptoms. It allows them to focus and function normally and allows them to engage in treatment better so we can begin their recovery process.
I didn't get hooked on drugs and alcohol till later on in life, till I was like 28 years old. And I don't know how that started. It was just some of the people that I was hanging with, and I would I would try it, and then all of a sudden, it became really bad. I actually Googled doctors in the State College area, and this number came up, and I was desperate, so I called it. I'm like, I need help. And it's hard to ask for help, I take 2 a day. I take 1 in the morning and 1 in the afternoon. I don't get high off of it. If you're doing it the right way and you're on this program and you're doing it right, you don't get high off of anything. You don't want to. That's the whole purpose of not coming to here, is not to get high.
Coming in for medicated assisted treatments, we don't look at just giving the client medication. We look at the patient as a whole. In addition to the medication, there is also individual therapy, and then there's group therapy that goes along with that. All the data shows that for opioid use disorder, you have a higher rate of achieving recovery and staying in recovery long-term with medicated assisted treatment coupled with therapy. I've seen success in the other levels of care, but I haven't seen long-term success like I see in medicated assisted treatment.
Since I've been on it, I've gotten a house, I have my car, and I've worked at my job for 3.5 years. That's awesome, but I'm a different person. So you have to just make yourself a better person every day. You know what I mean? You gotta live with the moment. Sometimes it takes minute by minute, second by second. But you just got to get up and just try to be the better person than you were before the next day. That's what I do.
The preceding program was presented by Battling Opioids, a project of Pennsylvania Public Media.